Hello, and thank you for joining the session. This is Dr. Farid, and today I'll be talking about XR in healthcare. A quick introduction about myself: I'm a resident in general surgery. I'm the president of the VRARA Association MENA chapter. Recently, I have been appointed as the co-chair of the VRARA Association Healthcare Committee. I'm also the co-founder and the CEO at Farid. And I also represent the International Virtual Reality in Healthcare Association in this region, also representing VRARA Health, and I am a member of the scientific committee at the UAE Genetic Disease Association. Apart from this, I have been working with a number of government and private institutes and organizations to help them implement XR in their practices since the past few years. So, as we know that a number of companies, enthusiasts, even healthcare professionals have been focusing on using the marvels of XR for improving healthcare practices. Why? Because this change had to happen a long time ago. The healthcare system has been facing a lot of challenges. It is constantly, even in today's time, we do hear the words of lesser number of healthcare providers compared to the population, a lesser number of trained staff across the world. So this is from the training or the academic perspective. Then we are witnessing a rise in chronic diseases from around the world. Although there is a huge improvement in medical practices, on the other hand, we see a rise in blood pressure patients and heart diseases. So how do we actually improve all these things? If you have been reading some news about XR in healthcare, you would have seen that there have been a number of proven studies from around the world that are looking into this and are helping to improve the industry. So today we will talk about features of an unrivaled program for XR implementation in clinical practice. So what does that mean? XR is a revolution. Me personally, I don't like to consider it a technology or a product or an application or a program that I'm implementing or piloting on for a year. For me, I really consider and I truly believe in this is a revolution. This is a step into a completely transformed world of healthcare, which is helping the medical practitioner, helping their patients, and improving the global scale of the healthcare industry. How do we step into this phase? Any transformation, I consider it that it is driven by collaboration. Collaboration between some of the leaders in the world, which are obviously there are companies who build the solution or build the hardware. Then comes the organizations that are helping to get on board using these technologies and then bringing them towards the public and the population. So it's a collaboration, and we need to understand how does this work, because only with a number of features of an unrivaled program we will be reaching towards the success of this. It's important for me to mention that throughout my experience or throughout my journey in the XR industry, it's not strange for me to be contacted by an organization which is reaching me or my team for a challenge, that we are facing a challenge with a certain hardware, or we try to use virtual reality but something is not working. It probably was not following the right method to do that. So although XR in healthcare has been in practice, and we have been talking about it since the past 4 to 5, 6 years or maybe more, the unprecedented time with COVID-19 has truly boosted this industry. It has helped us to come together as one human race and grow by supporting each other's, whether it's a company supporting another, whether it's a government supporting the entire ecosystem, or even it's public, which are now more open to look into the new technological options. XR is one technology that is literally, providing us so many promises that we have been hearing in the past. One example of this is telemedicine. Right, so we have been doing this through video since the past few years, and many of the institutes have tried to promote it. But imagine if you are able to connect and engage in an immersive way with your healthcare provider from a distant village, or just for the sake of maintaining social distances. And these are the type of science fiction marvels that XR really puts on the table. As I mentioned, that the revolution is not driven by a single company or by a single technology. And there are many players. So the first thing that we need to focus on is that this technology is new for everyone. So the first step is spreading education, is spreading awareness, and what I like to call activation program. Get people to learn about how is this happening. A small example of this is conducting nationwide initiatives, conducting programs related to preventive health, because that is a program that is targeting a large number of audience. Target areas such as primary healthcare centers, where a larger number of people would come. Not just from the population, but also the healthcare practitioners, for them to understand, how to communicate to patients about this technology and how to help to grow this industry. In this time, with the tremendous digital transformation that we are living in, it's the time of social media. And as we have seen, not just social media influencers, but even governments, policymakers, hospitals, even doctors, they go to social media to promote or even spread a news, or spread a new guideline, or spread the number of cases today in our city or in our country. So social media has played an essential role. So why not, I think it's a responsibility for our experts to be using that maximum in a positive way to spread small bits of pieces of information about the benefits of XR. We can talk about very basic things. For example, a walkthrough inside the human body to understand what is diabetes and how it actually works. In today's time, it's something very, very common. Most of us have one or more family member that suffers from diabetes. So that can be a game changer if we educate them better about this, rather than just spreading brochures and booklets. So this is one part. Another important part of social media is to debunk the myths about immersive technology. Immersive technology, just like any other industrial revolutions in the past, it is invading our lives. There is no escape from it. We just have to understand that this is how life is, and if we don't move forward, that means we are staying in the past, we are staying in the back. So a revolution, a technological transformation is essential for us as a humanity on a whole. So that's the part of social media. Then we see a surge and a huge attention to various devices, such as wearable technology is coming into shape. Home assistant devices are taking place. Telecommute apps are coming into shape, and telemedicine as well. So all of these areas are emerging, and people are becoming more acceptable on the benefits of XR. In order to describe what we can do for the healthcare industry using XR, literally everything that we do in real, we can replicate that in the metaverse. Let me focus on three major areas. One is education and training. Two is patient care. Then third is mindfulness and meditation. So there are various examples that we have been seeing throughout the years, from basic sciences such as learning about the whole human anatomy, learning about, furthermore, the clinical practices, the history taking, and the examination through a virtual avatar, which is very realistic and responsive to everything that we're doing to them, whether it's history taking or even physical examination. UAE proudly has been the first country in the world that has implemented virtual reality based medical training for ventilator in order to empower COVID-19 frontliners. Furthermore, we are able to use XR for programs such as teaching basic life support, using it for other sciences such as pharmaceuticals, paramedics, emergency cases, etc. Also, we have been transforming laboratories, laboratory sciences and experiments, genetics labs, all through XR. A huge part of XR is also helping us to connect to patients in remote areas, whether it's in developing countries or in our own, remote areas in our own country, or just in general people in need. So imagine if we are able to reach to them without physical boundaries, without time constraints, in order to help them and to be able to at times save a life. So all of this is today possible with the help of XR. Not only in tackling diseases or emergency situation, but also in preventive medicine, in meditation, in mindfulness, in distraction, pain distraction. So meditation and well-being have been greatly benefiting from XR, where you can literally teleport your patients to anywhere. Not just patients, even people who are sitting at home and who are confined by the rules of staying at home and social distancing, they can benefit from them and have a great experience. Furthermore, we constantly hear about a huge gap between the number of trained medical staff and the number of patients that need them. So XR is one technology that is helping professional medical experts to connect with trainees around the world in a matter of seconds and provide to them training of skills and practices that they need in real life in a responsive environment. So this is going to soon help to bring out a number of more trained staff. Also, there is a huge role for conferences and activities in XR. So any institute which is looking into implementing XR, there are a number of questions that we're looking into. What is this institute or organization? Who is their target audience? Is it an educational institute? Is it a hospital? Is it a government hospital? Is it a specific medical clinic, let's say for cancer patients? So that is very important to understand that how much role is there for practical use or for patient experience in your institute, right? And then we talk about how often do we need to change the content, how deep and how responsive, or how many modules do we need of one training program if we're looking into a pilot training. Then we look into number of users, because that will help us to understand if we are building a physical or an innovation laboratory, or if we are investing in learners while they are still remote. So how is the entire ecosystem is going to work? Then we talk about, because a lot of the institutes today already rely on e-learning and LMSs. So instead of, just giving them a new application or a new technology every time, it's important to make their life easier by integrating the XR platform with the existing system, whatever it is. Because we can do anything in the metaverse safely, I think it's a great idea to start the practice with some scenario which can be risky. For example, basic life support, where you actually have a thriving patient. And you need to learn how to save their lives, because if you don't, they might, not make it. Similar experiences we have been having in the ventilator training, because the difference between learning how to use a ventilator could very well be the difference between saving and losing a life. So that's a very extensive training, but with XR, everything is possible with actually saving the real machine to be used for the real patient, and using a digital one which has no risk of damage, and you are able to use it hundreds of times, and you are able to even create multiple scenarios as you would like to it. The key to a successful program implementation. An unrivaled program is providing you the best hardware that is suitable with your needs, the content which is aligned with your cultural background, with your language that you're using, with the expectation that you want to have, along with various other features that are applicable. And most importantly, the program should be scalable for you to be improving on later on. So what is the end objective that we're trying to reach? Is that if we are providing them something which is, it's an add-on to their existing experience, it has to be immersive, engaging, interactive. That's the whole purpose of XR in the first place. Then it has to be aligned with the learning goals or the objective of this experience. If it's a medical university, if it's a training hospital, the objective of the XR should be complementing that. Other other objectives of this program should be the ability to live communication, so that if I am a medical student, I should be able to, through the metaverse, communicate with my professor, even if he or she is at a distance, or if he or she is in another country, or if me, being a professor, want to connect with a number of 50 junior surgeons in one of the developing countries, for example. So this is very essential, that the platform should provide me live communication. One of the most important parts is that the program should be compatible with maximum number of hardware as much as possible, because we are not making it difficult for the end user to invest in many devices. How about if I am having a program that I can use using a smart tablet or a smartphone or even my laptop, not necessarily investing in a virtual reality device, because I might just not be ready for that type of investment as of now. So that is another very essential thing, and there are very powerful machines today that support the system very much. So overall, we're talking about keeping in mind the social distancing and the remote working rules, but maintaining productivity and connectivity, and continuing to improving lives. Basic capabilities of a successful program. So a cloud platform will definitely ensure the hyper connective environment. It will enable us with the help of now 5G and other smart connective solutions, it will help us to communicate better. When we talk about a development life cycle, so although this slide might look very extensive, it's pretty simple. So the type of development is actually involving multi-level of people, from game developers to simulation experts to subject matter experts across various levels. So we start about analyzing the scenario, the objectives of the institute, what's going on, what do they want to achieve to, and we would come out with a basic description. We would come out with the basic activities that the program would provide you, and the deliverables. What are you getting from it? What is the value proposition, or what do we need to achieve from implementing XR? We need to find, number one for me is finding a platform that is helping you to maintain distance, maintain the social distancing protocols, and understand how to work safely even if it is remotely or even physically, but most importantly, focus on the outcome and not let anything come in between work and productivity, because there are people's lives involved. Then we are focusing on cost effectiveness, because especially also in COVID-19 times, there are huge budget that needs to be invested elsewhere in research and probably in finding vaccines and medications and all of that. So there is lesser budget for innovation. So definitely this is an area that we need to keep in consideration. And of course, XR is a technology that we can use from anywhere in the world with the minimum space from the comfort of our own seats. So coming to the end, in the end, I would like to share a bit more about some of the success cases in the VRARA Association and why it is important for you to become a member today without any delay. So recently we have concluded our MENA chapter activities, which were consisting of 4 different tracks: enterprise, education, healthcare, and entertainment. Each track was hosting distinguished speakers from around the world, from companies like Ether, Microsoft, from HP, as well as institutes such as the Royal College of Surgeons of Ireland, emerging technologies such as Cleanbox, and some of the brilliant names that I might not be able to mention all. But all of these people have truly enlightened us that XR is here today, and that is helping us to improve human lives. If I talk only about the healthcare, we were extremely delighted to have with us Professor Sean Tierney from the Royal College of Surgeons of Ireland. We have had Dr. Raphael Grossman. Many of these names don't require any introduction, but they have been really giving us a positive hope when it comes to XR in healthcare. We have had with us Irma Rastegaiva and Amy Hedrick from Cleanbox. So all of these amazing people, they are pioneers in using XR for improving human lives. They are considered unconventional medical doctors who welcome technologies with an open arm, and also further devote their times to spread awareness and knowledge about it. So the whole event of XR 2020 has been greatly impactful with great reach, and in the end we have learned that how XR is helping the healthcare sector. So all this was possible with us collaborating with the VRARA Association, which is keen to bring experts from around the world with enthusiasm, creating a global community which is working together to build industry standard, do the research work, and come out with reports and case studies for overall improvement of human lives in different sectors with the help of XR, AI, and other fourth industrial revolution technologies. Thank you once again for the opportunity, and hope you have a great session.